Good afternoon, I'm Kimberly with ARC Physical Therapy Plus, and I'm here today with Connor Redmon from our St. Joseph and Cameron, Missouri clinics. He is a physical therapist and one of our vestibular specialists, and he's going to teach us a little bit today about vestibular therapy. So Connor, can we start with you explaining what vestibular therapy is and what are some symptoms people might experience?
Sure. Vestibular therapy is going to be therapy targeted to your vestibular organ or your inner ear. The most common complaints would be vertigo or having some room spinning dizziness whenever you lay down on one side, dizziness or lightheadedness, feeling off balance, or even people that have suffered a concussion. It's important to note that not everybody that needs vestibular therapy has had a concussion, but oftentimes those that have had a concussion would benefit from vestibular therapy.
Okay, perfect. And can you go ahead and show us or tell us about some of the exercises or treatment methods you might use in treating these patients?
Yes, so one area that we would work on would be vision. So we could work on some visual tracking or smooth pursuits. So just tracking a popsicle stick from side to side with just their eyes, not moving their head. We could also work on balance exercises. So static balance, standing in one spot with their feet as close together as they can, and then we can move on to more dynamic balance activities, so like heel-toe walking, and then we can add a more functional task, like turning their heads when they're moving, to kind of simulate walking around in the grocery store.
Okay, perfect. And can you give us some examples of other functional activities as their symptoms resolve, other things you might do to help them get back to work or just the sports or that type of thing?
Sure, especially with concussions, dual task treatment is very effective in helping people get back. So that's kind of working on the same things, those visual or balance exercises, and then adding a more cognitive or involving the brain more in the task. So working on that dynamic balance with head turns, and then maybe having them call out what they would use in a recipe for bread, something like that.
Very cool, interesting. And Connor, what do you enjoy the most about working with vestibular patients?
What I enjoy the most would probably be just how creative that I can get with the exercises. I'm not really constrained to a certain body part or anything like that. We can really treat the whole body and make sure that people are safe and that they feel ready to go back out into their community.
Wonderful. Thank you, Connor, for your explanation today. If you are in Connor's area, St. Joseph or Cameron, Missouri, please reach out and he'd be happy to help you with some of these vestibular symptoms. Thank you. Okay.